Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
Welcome to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. I'm Stephen Newmark, Director of Policy at the Global Healthy Living Foundation.
And I'm Zoe Rothblatt, Associate Director of Community Outreach at GHLF.
Our goal is to help you understand what's happening in the healthcare world to help you make informed decisions to live your best life.
And today we're joined by Kristal Hartman, who works with the Obesity Action Coalition, and she shares her story about being a patient, how the medical system failed her with some of the common misconceptions around obesity, ultimately finding the right care team and the advocacy that she does now. So, Kristal, welcome to the Health Advocates.
Welcome, Kristal.
All right, why don't you start off by introducing yourself to our listeners?
Yeah, happy to do that. So my name is Kristal Hartman, and I am a person living with the chronic disease of obesity. I am a proud member of the Obesity Action Coalition. I have served in many capacities on committees and on the board, and I am currently the chair of the National Board of Directors for the OAC. I'm a mom of 3 boys, and I live on a lovely little farm in Oregon, and I'm really excited to be able to talk to your listeners today.
Yeah, I'm so excited that you're here having conversation with me and our listeners. And we had got connected through your work with OAC. I was wondering if you could tell me a little bit more about how you got involved with them.
Yeah, absolutely. So I actually did my very first advocacy day on Washington, D.C. on Capitol Hill. And as a prep for that, we had a group come speak to us about living with the disease of obesity and how to really tell our story when we were meeting with Congress. And that was 2 of our OAC members. And after they presented and walked off the stage, I ran out of the room and said, "Who are you? And I want to get to know you and what kind of work you're doing." And so it was so wonderful because they are the ones that introduced me to the Obesity Action Coalition. And they said, actually, in a few months, we're going to have our annual convention. And that convention was in Washington, D.C. And so I decided that I was just going to sign up for the convention. And I didn't know really anybody else that was going to be there, just the 2 folks, Patty and Ted, that had introduced me to the OAC. And so I showed up, not really sure what to expect, and was incredibly welcomed into this amazing community of people where we really had the opportunity to connect with each other and to get great science-based education about obesity and to learn how to advocate for care for ourselves. And at the end of that weekend, it was amazing because we wrote on a kind of like a big card what our key takeaway was from our time together. And I remember that I wrote, "I found my people." Because I had felt really alone in my weight management journey. I had one person that was kind of my mentor through my bariatric surgery, but I was so far away from my surgery center because I live in a small town and had to travel to our big city for surgery that I wasn't able to really connect with people because back then they were in in-person support groups per se. And so I just felt like I had found the people who were living lives that were so similar to me and having experiences that were so similar to me. And OAC has been and will continue to be an important part of my obesity journey.
That's amazing. I'm so glad you found them. I'm not sure if you know this, but I'm also a patient. I have arthritis and Crohn's disease, and I agree with so much of what you're saying that finding a community is such a turning point in the patient journey when you're just like able to be around people that just get it in a way that other people don't.
Yeah, that's so true. And so I'm so sorry to hear that you're managing chronic conditions as well. But you're right, nobody understands it like the people who are also going through it.
So, taking a step back, can you tell me a little bit more about your patient journey? And you mentioned surgery, like how you came to make a decision to get surgery and like how has it helped you or you're feeling since, maybe just from diagnosis to now. I know it's like a long thing, but just like, highlights of the journey for you.
Yeah, absolutely. So I started actually my journey with obesity in my teens. And it really came about because I was having really, really painful periods. And I was put on a form of birth control that was sort of like injected, with a needle. And at that point in time, to try to manage my cycles, they felt like this was the best option. However, very quickly and continuously, I ended up gaining a lot of weight during this time. And so I left. I was on dance team. I was the girl on dance team that needed the plus size dance costume. I was always super active. I played basketball and I was on dance team and I did everything possible. I was in choir. And so I was just this really super active kid and always had been. But my weight started rapidly increasing after this form of birth control. And so what ended up happening is that I went to college, and instead of the freshman 15, it was more like the freshman 50 for me. And I just continued to gain weight without any ability to really figure out how to lose weight. And so it was finally in my early 20s that I saw an endocrinologist for the first time. And she is the one that actually diagnosed me with polycystic ovarian syndrome. And part of that really is insulin resistance and a real difficulty managing weight. Part of that also includes issues with fertility. And so she told me at that time, I was young and newly married in my early 20s, that it was probably going to be difficult for me to have kids. On top of that, I was diagnosed for the first time with thyroid issues too. So I had kind of all of these hormonal issues that were impacting me all at the same time and really working against any efforts that I tried to take with diet and exercise to lose weight. And so when I started my fertility journey, like she said, you may have problems getting pregnant, you may have problems staying pregnant. And that was true. I had a miscarriage and then I had a successful pregnancy, but then I couldn't get pregnant a second time. And I had to go on some hormone medications to help to get pregnant. And I had another miscarriage. And then I finally had a successful pregnancy with twins. And so during this time, I'm taking all these hormones and I'm going back and forth and up and down with pregnancies. And then I had a twin pregnancy where, I also had to obviously gain weight to protect two babies. And by the time that was all said and done, I was just at my highest weight I had ever been. That started to impact my health. And by my early 30s, I found that I was so sick. My kids would say, like, Mom, you're so tired. You just come home and you like go to bed or you get on the couch and we'll watch a movie. I was exhausted, having a hard time getting through my days. And I talked to my physician about this, my primary care physician, and we had the conversation about weight pretty consistently as I was going in for all of these comorbidities of obesity. And so every time I had something new pop up, she'd add a medication. So in my early 30s, I was on 14 medications
Wow.
for comorbidities of obesity. And yet every time we talked about it, she would say, like, you're young, you're educated, you're in the medical field. You should be able to handle this. You should be able to do this. Put your fork down, walk a little more, eat a little less, and you would be able to control your weight. And so I internalized a lot of that. As people living with obesity, we deal with a lot of weight bias and weight stigma. A lot of that is external, but a lot of that is also internal. And oftentimes we say the meanest things to ourselves that we would never ever say to another human being. And so I just felt really guilty. Like, I'm so successful in all of these other areas of my life. Why can I not control my weight? And so it was my endocrinologist at the time who was on the weight journey with me. And we tried different diets. We tried some of the early FDA approved medications for weight loss. And unfortunately, I had a bad side effect from one of those. And so at some point in my early 30s, he said, okay, we've literally tried everything. And I think it's time for bariatric surgery. And I couldn't believe that because in my mind, people who had bariatric surgery were older, 50s, 60s, 70s, maybe. And here I was maybe like 34, 35 at this time. So I went back and talked to my primary care physician and she completely shamed me. She said, you know what? I can't even talk my 400 and 500-pound patients into surgery. I can't even believe that you're considering this. And she was saying this while filling 14 prescriptions every month for me.
Oh my gosh.
And I also had a BMI of 42. Now, we used to call that morbid obesity, and thank goodness we took the word morbid out of that. Now it's just severe obesity, or obesity is now diagnosed in different types, like type 1, 2, 3, 4, etc. But back then, I was in the morbid obese category for my age and height and weight. My BMI was 42. So I waited a whole year. And during that time, I got even sicker and sicker. I had to be hospitalized twice for comorbidity complications. For me, it was asthma and breathing. And so it just got worse. And so finally, a year later, I called the bariatric surgery office and I felt like the biggest failure. And I was crying when I called and made my first appointment. But when I went and I got true obesity care for the first time, it was such a relief to be around physician and staff that knew exactly like what to do and how to treat someone living with this disease. And so that was a game changer for me. Since then, it was about a year later that I was introduced to the Obesity Action Coalition and then became an advocate all of these years. But also during that time, I learned that I was going to need every tool in the toolbox. So, for example, I needed bariatric surgery, but I also had weight regain. And at that point in time, it was available for me to get one of the GLP-1 medications and it was covered by my insurance. But once it was no longer covered, I've had some yo-yo weight gains and losses because for me, that hunger signal, it's not like I got the surgery and it was one and done. That's not what a chronic disease does. Even with surgery, this is still a long-term disease. It still manifests itself in different ways. It's complicated and multifactorial. And so I was still having those major hunger signals and obsessing about food. And GLP-1 certainly helped me with that. And yet they're absolutely nearly impossible to get access to because of lack of coverage. And I will address some of that a bit later. But ultimately, I needed mental health care. I needed help from a dietitian and nutrition to help me make sure that I was getting all of my correct nutrients and vitamins. So, what we really advocate for is the ability to access all of the tools in the toolbox. And here I am today, and I'm still utilizing several of those tools. And I know I will for the rest of my life because a chronic disease means it's a lifelong disease.
Yeah, thank you for sharing all that. It angers me so much that one doctor just like failed you and didn't give you any of those tools. And I'm wondering, what do you wish that doctor had said to you or other people around you had said to you that would have been helpful instead of the harmful messaging that you did receive?
Yeah, definitely. Well, first of all, Zoe, I didn't think that I deserved better care. And that's really hard for me to think about now when I look back at that time. I thought this was all my fault, this disease. And when she was saying things like that, I internalized that and was like, yeah, she's right. This is so true. I should be able to handle this. What is wrong with me? And so that was really difficult time for me. After I had the surgery and lost 100 pounds and got into a normal BMI range, she suddenly became like, oh, well, see, like that worked great. And so I actually changed healthcare providers at that time because I said, I deserve better than this. And I now have a healthcare team that is just like my dream team. They're amazing. And that would be one thing that I would encourage for people during that time when I was hearing those wrong kinds of messages is just to be able to say, this isn't fair. We know that you're working really hard on your health. And we want to be here to support you through whatever tools you may need in this journey. Because there were people that were nervous that I was having a permanent surgery, right? I mean, there's always risks with that. And so the best thing that is that my family and my friends and my other doctor were there, and my mentor too, who had had bariatric surgery about a year before I did, were all there, and they were that support team that I needed. And so if someone has a person or a healthcare provider in their life that is saying these harmful messages and contributing to weight bias and weight stigma, I really encourage people to find the right healthcare provider that understands this disease and is willing to be on the journey with you and help you with all of the different tools you may need. Even though Obesity Action Coalition has a physician finder where you can look for obesity medicine specialists, and a lot of them see people virtually, right? So it doesn't even matter where they are in the country, but we deserve better healthcare than that, and we deserve non-biased, non-stigmatized, compassionate healthcare. So I really encourage people to find that healthcare team that supports them.
That actually leads me into one of the questions I had for you. I know that an Obesity Bill of Rights was recently published, and I think OAC was involved in that, right?
Yeah, absolutely. it's exciting because it's honestly the weight stigma and the weight bias is actually a discrimination issue. In our country, the trends are changing, we hope, toward anti discrimination of all people for all reasons, right? That we shouldn't judge or shame or blame or, have biases against people of, certain size or religion or sexual orientation, et cetera. And unfortunately, people living with the disease of obesity still face a lot of discrimination. And so we worked on that patient bill of rights because we believe that as people living with obesity, we deserve the same compassionate treatment, the same kinds of access to affordable obesity care, and that, as a nation, we should be doing things and making decisions to help people living with the disease of obesity, just like any other chronic disease, like people living with diabetes or high blood pressure or heart disease. Our patient bill of rights is really about having equal access and equal rights across the board.
As you should. I mean, it seems so obvious, right?
It really does.
But that's not the reality.
That isn't. And we're still shown in media without, most of the time, it has no head. When we're shown in media, articles online or on the TV, we're often shown people living with obesity are rarely shown in a positive light, right? Like maybe exercising or eating a healthy meal. We're usually shown without a head, so it chops our head off. It usually just shows the middle, generally focusing on a big jiggly tummy, oftentimes holding a, fast food restaurant cup or burger or whatever it is. And that's just not the reality. The reality is that people living with the disease of obesity care very much about their health. And we can guarantee, absolutely 1,000,000% guarantee, that we have tried a million things to manage our weight. So this isn't a disease that's about lazy people who don't care about their health, who are unmotivated. That's not who we are. That doesn't define us. This disease does not define us. And in fact, we're the exact opposite of that description. And absolutely, we all understand that there is personal responsibility and that moving our bodies and eating healthy foods are a critical part of managing obesity. But we now have actual science-backed evidence that shows that this disease is so much more, that metabolically and physiologically, our bodies do not work the same as people who do not have excess weight. And that's where all of these new medications and treatments are coming in to try to address some of these issues that are really specific to people's bodies who have extra weight. And that science should be supported with affordable access to these treatments and to these tools.
Totally. So let's talk about some of those treatments and tools and the advocacy that you've been doing around them. Obviously, these GLP-1 drugs have gotten a lot of attention in the media. Like, what has that been like for you?
Yeah, honestly, it's good and bad. The good part is that it is elevating the conversation about obesity and it is making people more aware. In fact, there was a Pew Research study that just came out that talked about the fact that the majority of Americans now believe that obesity is a disease and that it should be treated as such. So that kind of trend is changing in a positive way, but it's also been really difficult to have all of the media coverage too, because a lot of that media coverage does not focus on the science of obesity as a disease. And it's often related to vanity use, right? So like this star lost this much weight, or do we think this star isn't admitting that they're using Ozempic or whatever? And so it's really highly sensationalized. And it makes it also sound like everyone in the country is on a GLP-1, and that's just not true. And so when we are advocating for access to these treatments, we're advocating for comprehensive care. So that means that you actually are connected with a physician and physician team that is helping you manage your overall obesity. It's not just about writing the prescription for this one type of medication. It's also making sure that maybe you're working with a mental health care provider because you have maybe eating disorders or different issues that contribute, right, to your view of food. And maybe it's a nutritionist that will help you make grocery shopping lists and put meal planning together. I mean, there's all of these other components besides just medication. And so when we advocate, like we were this week on Capitol Hill for the Treat and Reduce Obesity Act, so TROA, Treat and Reduce Obesity Act, when we're advocating for that, there's two parts. It's comprehensive care. For seniors or older adults in America, we believe that on one hand, that they deserve all different types of healthcare providers to help with obesity. Right now, for Medicare, only primary care physicians can bill for obesity. And even when they do bill for obesity, they have to bill it 3 or 4 down because it's not going to be a visit that's paid for if it's just primarily obesity. And we also know that primary care physicians, number one, is obesity is not their specialty. And number two, they hardly have any time with patients. I mean, we're talking 10, 15, 20-minute appointments where they're addressing all kinds of things. And so their lack of time to truly address obesity, one part of the bill is saying, okay, there are other kinds of healthcare providers that can also bill for obesity. Maybe it's a cardiologist or an endocrinologist or a dietitian, but it opens up the ability for people to add to their healthcare team for treatment of obesity. The other part is access to the FDA-approved medications. And right now, Medicare is paying for them for diabetes, but they are desperately worried about the cost of covering these same medications at the doses that they are provided for obesity. And first of all, they don't look past about 10 years. Congress doesn't when they're looking to pass a bill and look at the cost of that. But we're really urging them to look at what happens 20, 30, 40 years down the road. So I had my bariatric surgery when I was 36. So as a 35-year-old, before my surgery, I was on 14 medications. Fast forward that 30 to 35 years, I would have been a Medicare patient at 65 to 70 who was incredibly expensive because those 14 medications probably would have turned to 25 medications. I would have already had diabetes because I had pre-diabetes. Maybe I would have even had my first heart event as a woman living with obesity. And so we're really encouraging them to look long term so that they understand that by treating obesity now, they're actually decreasing the incidence of the comorbidities like diabetes, heart disease, high blood pressure, et cetera. So those things will actually even out one day. We know that the expense is daunting upfront, but as we treat obesity, the incidence of these other diseases will decrease.
And when you meet with legislators, what sort of response do you get? Are they like more in favor of the bill? Do they have a lot of questions for you? What's it like?
Yeah. They do have a lot of questions. It's been really interesting because I was on the Hill in December and then again just this week. And the news media coverage actually means that there is a lot of questions about the correct utilization of these drugs and what we're really asking for, which is comprehensive care, not just someone to write the prescription because you need to lose 15 pounds before your class reunion, right? That's not what these are for. This is for chronic obesity and for people who are actually diagnosed and being treated as such. And so we have to explain that. I will say that before these drugs were even on board, we were advocating for TROA. For 11 years now, we've been trying to get this passed. So this was happening long before all of these pharma companies jumped in and started making obesity drugs, right? And so we were advocating for equal comprehensive care for 11 years now, and we still have yet to get this through. And I will say the one thing that we have seen a good trend in is that more and more people do believe that this is a disease, that this isn't just an issue of personal responsibility, that these people should just take care of themselves. You did this to yourself. Now you need to fix this, right? Because that's been the message that we've received for years and years is that you did this to yourself, therefore it's on you to fix it. And the Medicare rules pretty much explicitly state that because they consider weight loss like a vanity, situation and an unneeded type of coverage. So we really explain that to them. A lot more people in Congress are believing and admitting to the fact that this is a disease, but they have a ton of questions about cost. And we're putting a lot of pressures even on our pharma folks to really rein in the cost of these so that we can get these bills passed and that people will have access to reasonable copays for these medications.
We really have been brainwashed to think that obesity is just a personal choice and not a disease. And I'm so glad to hear you squash that and say, no, it's a disease. And we need to admit that, like, say it out loud. Obesity is a disease. And it's so important that people like you are sharing your story. And, I'm just so grateful for the OAC and being connected to you guys because it really is such a misconception out there.
It really is. And your personal story means everything. And that's what we teach all of our new advocates. I had the opportunity to spend the day on Monday when we were on the Hill with one of our new advocates who also lives in Oregon. And just seeing her excitement and passion for the work that we're doing is so fantastic. And it really comes down to the personal story. When we're talking to Congress and we're saying, we are your constituents, we live in your state, we vote for you. This is something that is critically important to people living in your state. And it is time to treat this as a disease and to treat it equally to all other chronic diseases. And so that's an important part of every single one of our stories and our conversations with Congress too.
For sure. And how can people get involved if they want to with obesity advocacy?
Yeah, we would love to have more advocates. And advocating doesn't necessarily mean that, you have to fly to Washington, D.C. and speak to senators and House of Representatives. If that's your jam, great. We would love to have you join us on Capitol Hill. But there's so many different ways to advocate. You can advocate in your own community. You can advocate at the state level, and you can advocate at the federal level. And so I really highly encourage people to go to the OAC website. It's obesityaction.org. And there's actually a whole entire website called the Action Center that will give you all different sorts of ideas of how to take action. Sometimes taking action is going on Instagram or Twitter and responding to negative news stories or people who are exhibiting obvious weight bias and weight stigma and just calling them out and say, hey, you use this picture. Did you know that OAC has an image gallery of people living with obesity? And we want you to use that image gallery instead of the headless jiggling tummy that you used in your news story. And so there's so many different ways to advocate and to get involved. And while you do, you're actually also becoming a part of this incredible community of people where you're going to find support and science-based education at the same time, which, it's a kind of a three-prong approach at OAC. We really focus on support and advocacy and education. So we would love for people to join as a member of the OAC and to advocate in any way that they feel comfortable doing so.
That's amazing. Thank you. And we'll put a link to that in the show notes so people can find you guys.
Great.
And we're excited to work with you more on some advocacy trainings and...
Yes, we can't wait. Yes, I'm so happy, Zoe. That's what Kristal was telling me, and one of our team members of our staff of the OAC. And we love that your team is so passionate about this and passionate about chronic disease in general, but that you're really ready to jump out and help us with this cause, right? Help us really hit home that obesity is a disease and that we deserve equal and compassionate and non-biased care and access to all of the treatments and tools in the toolbox.
Exactly. Yeah. Well, thank you so much, Kristal, for joining and sharing your story and your work with OAC. I really appreciate it.
Absolutely. Anytime. We'd love to jump on and chat, and hopefully we get to see you on the Hill one of these days too.
Definitely. Yeah. Looking forward.
Yes, us too. Thank you so much.
Well, thank you, Kristal. That was another great discussion. And Zoe, you're becoming quite the interviewer. I hope we don't lose you to ABC News or something with your skills.
I'm right here. I'm a health advocate at heart. You guys don't have to worry about me, but thanks, Stephen.
Excellent. Well, it was a really great discussion, and I definitely learned a lot. I know your next question is going to be about learnings. And I'll just say for me, she talked about her patient journey and what it's like specifically with her patient journey. It was really the most that I'd ever heard from someone specifically dealing with obesity and that patient journey. So it was quite a learning for me, and the misconceptions and bias around obesity.
Definitely. And I really enjoyed the part where she talked about just well-rounded care.
Yeah.
And supporting patients in multiple ways in a multidisciplinary healthcare team. That was really great.
Yeah, totally. Well, we hope that you learned something too. And before we go, we want to encourage everyone to check out all of our podcasts at ghlf.org/listen.
And if you have any questions, comments, episode topics, just want to say hi to us, definitely email us at podcast@ghlf.org. Well, everyone, thanks for listening to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. If you liked this episode, give us a rating, write that review, and hit that subscribe button. I'm Zoe Rothblatt.
I'm Stephen Newmark. We'll see you next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.